Morning at 10 TV, and this is the Take Note segment, and today we'll be talking about teenage sexual and reproductive health and also the rights that come with that. And so, did you know that 70.9% of the health facilities in Uganda do not have an adolescent health center or clinic to that regard? And yet adolescent sexual reproductive health remains a great challenge in society today. Every single day we have a young person either getting an STI, an STD, either getting pregnant, and all this, experts say, is due to ignorance. They do not have this information. And so what can be done to improve this? That's the big discussion we'll be having today on Take Note. And in studio, we have Dennis Bukenya, who is the Deputy Director of the Naguru Teenage Information and Health Center. Welcome to the show.
Thank you.
We also have Winnie Musubika, who is the Service Delivery Manager at the same center. Thank you so much for making time. Uganda is by and large regarded to be a young population. But I'm curious to know, from the last census that was done in 2014, what are the actual numbers now for the young people? We can start with Dennis.
Well, thank you very much. I think that's a good question. You know, many times when we talk about these things like census, like, you know, statistics, sometimes the viewers and the people don't always pick them and take, you know, the figures with them home. So I always choose to say that for anyone who is in this country, I want them to be observant. Wherever they pass, I want them to have their head lifted a little bit up and observe the people that are around them. I think that is when you can understand the statistics very well. Go to the schools, go to the markets, go to the washing bays, go to the border stages, go to offices. That is when you will have a picture that this country is a predominantly a young person country. Even with just forgetting that maybe over 50%, over 70%, it is visible in this country that everyone that you can easily trace is a young person.
Is a young person.
Yes.
And actually they're saying it's over 80% of the total population.
Exactly.
Young people. These are young people who are, so to speak, when they get to the adolescent age, that's when their bodies are telling them things. You
know it.
So they're sexually active. When at the Naguru Teenage Information and Health Center, when they come to the centers, what do they tell you? Winnie, you can answer that because you're in the service delivery docket. What do they tell you?
Well, before they can actually tell you anything, there is a lot to observe.
Yes.
And we already have the background knowledge that the situation they're in is not the usual situation. They are not adults, they are not children.
Yes.
They are confused. So the questions they have are really pertinent, and if you don't answer them at that level, then they are most likely going to get the answers elsewhere, and you have no control over that at that point. So when they come, in most cases what they are going to tell you depends on how you approach them. Because they are not sure of what is happening.
Yes.
So if you ask them something, then you need to be able to address it, understand them from their point, and be able to address it from their point of view.
From their point of view.
Exactly. So at Naguru Teenage Center, that is basically what we focus on. How do you approach these adolescents? How do you handle the adolescent? Some of them actually come to you when they have deep-rooted issues that they will not tell you unless you dig deep. You need the skill to be able to dig deep there.
We've just seen that there's a shortage of these clinics that actually tend to the adolescents when it comes to the sexual and reproductive health information. So at Naguru Teenage Center, you're one of a kind. Like, you're like a drop in the ocean. You're just like alone, so to speak, because we have very few centers like yours. What is the inflow of young people per day? How many come to your center per day? Maybe we can ask you, Mr. Dennis.
I think plainly, the center has a range of services. We have the mainstream where we provide HIV testing and also consultations with physicians and all that. And then we have a specific section for young people with maternal and child-related child health, you know, and this is where we also take care of the teenage mothers. So in the mainstream, we see about 100 daily walk through our doors, and in the antenatal, that all section, we see about 25
to 30
per day.
So the average, of course, with all the other things, questions and all that, it's about 150.
150.
Yeah.
That's a big number, given that it's just one center in a day.
Mm-hmm.
When they come in, do they come with the parents or they come alone voluntarily?
Yeah.
Some of them actually come alone, but they've been referred by those that have been there before, most of them.
Okay.
And then we have those that come with their parents. Yeah, but usually the ones that come with their parents are the ones below 10 to 15 years. Those are escorted a lot. And then the ones above 15 usually come in alone or with a partner. Some of them have partners, like the ones above 18, 19-year-olds, 24-year-olds.
And then they come with the parents. What's the conversation around that? Because I'm thinking by the time a parent is taking their child to such a center, what happens?
Well, we do have some services for parents also, because remember, we also want them to understand their children and to be able to address their needs. So when a parent comes to Naguru escorting a child, we take the child aside, and then we also have the parent talked to by counselors on how to handle their child.
Thank you.
Yeah, so we kind of handle them. Sometimes you might need to talk to the child without the parent. Then other times you may need to invite the parent, and then you have a discussion together with the parent.
That's quite commendable, because I'm thinking by the time they're coming, there's some conflict resolution.
Oh yeah, no, actually that is what I wanted to mention, that sometimes it's not all rosy actually. Sometimes they come, the young person is here and the parent is here. And sometimes parents say, I have finally delivered for you your package. For me, I'm leaving. You know, I have had enough. Some parents are like, today I have made it here. I want to know everything. You get that kind of thing. So we have also parents like that. And like Winnie says, I think we handle depending on the situation. Okay. Sometimes we've had a couple coming and they don't agree on the issue of their child together. So there is a child, there is a parents, you know, so you have also to manage that. And this is what Winnie says. So we support the parents and also we support the young people.
And at the end of the day, they go home loving each other again.
Sometimes sometimes not on the very day. You might need about 2 or 3 more, you know, engagements. Sometimes it's good on the first day and they can walk back together.
And if they can't walk home back together, what happens? So
of course,
does this child sleep?
No, we're a drop-in center, so we have a plan. We always must, you know, make some things work on that day.
Okay, for the couples that come, the young couples, like you're saying, when they come on, what is always the biggest concern? Is it STIs, STDs, or is it matters to do with the maternal reproductive conversation?
There are usually 2 major issues: HIV testing as a couple, and also antenatal care, escorting the mother. So we also have cases where you've tested somebody and they have an STI, they come alone, and then you have to invite the partner. So they usually come back again together. But those are mainly the issues: HIV testing as couples, and also the antenatal section.
Antenatal section. Someone told me that nowadays going for HIV testing is a thing, it's a gamble, because many centers do not take it as a sensitive matter. So when you go, they don't take time to, you know, counsel you after they get the results. They don't take time to prepare you for the results, if they're negative or positive. So is that something that you actually take seriously at the center, given that you're dealing with young people who are not yet fully mature? How do you manage to disseminate that kind of information and still tell them, you know what, in case it's positive, there's still life at the end of the tunnel?
At the center, we're we have a lot of information going on. That's the first thing. As soon as you get to the center, information is all over you. On our walls, there's information on HIV. On our screen in the waiting area, there's information on HIV. When you reach the counselor, they are going to talk about HIV. So, and we have trained counselors that are able to handle these cases, and specifically trained to handle adolescents. And for sure, the adolescents are a special group that we really think you need to prepare really right.
Correct.
Before you can do that test. So for those young people, we take a lot of time. Take a lot of time talking to them and making sure that they've understood what they're going to do, and then you can offer the service.
Yes.
Yeah.
Yes. You are just, you know, you're in the bracket of a very small percentage of centers that deal with such matters to do with adolescents. Publicly, because not everyone will afford to come to Nakuru. Nakuru, the environment is quote-unquote posh. How about the rest of the youth? What is the government doing to ensure that we have more centers put in place where youth can easily access, youth in the ghetto, regardless of their environment, can easily come and say, you know what, I need some testing, I need some counseling. Do you think the government is doing enough?
Well, that's a very good question, and I think there are a number of things around that.
Yes.
But I will say that with our experience, I think the government has attempted to make a lot of steps. But like we started, this is a very big population.
Correct.
I think sometimes we forget that as we plan, or even as we think about it. For instance, there's been an attempt to have policies. And you know, when you have policies in place, that means you're making a choice about solving something.
Yes.
There's been also attempts to start, you know, the youth centers, the youth corners, and also there's been attempts to integrate. Now, the challenge we have is about functionality now, you know, because it is one thing to say that I have started a service. It is another thing to keep the service running.
Correct.
And being able to serve the population. And I think that is where we're struggling. Also, I think in Uganda generally, we have failed to generate consensus on a number of things. I don't think it's only about adolescents' reproductive health, where there is confusion, but there's a lot of things where we feel like sometimes we conflict each other in terms of what we should prepare for the young people. And I think reproductive health issues for young people is one of those areas. You know, like in this country, there's been a very huge debate about contraception. And, you know, but that doesn't stop the teenage pregnancies from happening. And we need to generate consensus on how do we want to save this future Uganda. The pregnancies are happening, you know.
Yes.
The abortions are happening.
Yes.
And it is, I mean, the government, through the Ministry of Health and other ministries, to provide the framework through which we can work together as partners to make sure that we do this. And I know there's been a lot of engagements, you know, there's been a lot of discussions. I'm sure even in the media you've been seeing this.
Yes.
But sometimes I don't think we have a lot of time right now, because teenage pregnancy right now, we are in the 20s. We've stagnated there for so many. We are among those huge ones in the world, because ideally no teenager should be getting pregnant, most especially in our world, really, you know, where we have a lot of structural problems, where we have sometimes high unemployment rates, families are broken. So you need to support the people thrive on their own. And the way to support them thrive on their own is give accurate information, make sure that the services are available and they're inclusive. And if there are issues, dilemmas around those, they have to be solved. Because like Win has told you, for them, they're young people. A lot is going on. Some things, they don't have answers. Some things, they even don't know who to ask. Parents are saying that is not our role. You need to go to your aunties. Aunties are nowhere. You know, they have never seen even an auntie, or if they've seen an auntie, they've never been close. You get
It's
that
true,
kind of
it's
thing.
true.
Yeah.
I'm personally a parent as well.
Yeah.
And to tell you the truth, I dread when my children will get to teenage level. You know, and I think it's the fear of all of us as parents, because you don't know, fine, as much as you might be giving them this information, we're having a discussion and we're saying the sooner the better. The sooner you start, you know, making them understand the sexuality, the better. But then we are always afraid, like, now what will happen? I've done my part, but what will happen?
Yeah.
And the government actually made a great move, and just the other day they launched the framework of
the National
sexuality,
Sexuality Education
exactly,
Framework.
into the curriculum, that it's something that will be taught in the schools. But today you'll be having an engagement with some members of parliament on the same as well. In your opinion, what more can be done? Already we are seeing that over 70.9% of the health centers do not have adolescent clinics to just, you know, make sure that these young people feel free to go and get the information. What will you be engaging them on?
So today, I mean, we want to, this is gonna be like our second engagement. We want our honorable members of parliament to understand that some of the key things that matter in this world is the health of young people.
Correct.
Because this is the pivot for this country. We want them to put this highly on their agenda, like any other things, security and the rest. And the message is very simple. We are giving them information because sometimes they are busy, so they get a little bit out of touch to some of the things. But also, Uganda has a lot of pressing needs.
Yes.
So it is the priority list has to be got right for us to be able to move, because there are many, and of course we feel with them. But the issue of health and development for the nation starts with its people.
Yes.
And in Uganda, it lies in the young people. And that is what we are telling them. But we are also raising awareness on some of the landmarks, like the National Sexuality Education Framework that the Minister of Education and Sports has just launched.
Yes.
It will need money, for instance, for it to be rolled out. We want them to support the various ministries to make sure that this happens. The reason why we have this framework, it's because at some point the country had banned sexuality education.
Yes.
Because there was comprehensive sexuality education. And Uganda says that we don't want comprehensive sexuality education, we want sexuality education. And we are saying, okay, so for the sexuality education that we want, that has been, you know, thought about, culturally sensitive, religiously, okay, how is this going to be operationalized? But also we are talking to them that this is for schools. What happens if they are not in schools?
Correct.
Today you're a parent, you're telling us that, look, I just don't get these things. But what happens now for the parents? What happens to a number of young people that are out of school? What happens to the young people that drop out of school? Because there are also many.
How can we reach them?
Exactly, how can we reach them? We know that those that go to school, they are going to get this information. But what happens to those that are not in school? And then we want to hear what they're already thinking, so that we can input. So we've mobilized other CSOs, we've mobilized our colleagues from the ministries that can join, and we just want to dialogue. The young people are there, so they can talk to them, but also we give them a chance to come and visit Naguru. Because, I mean, the parliament is here, the center is in Bugolobi, but there are many. When we had our first engagement with them, a number of them, they say, oh, I pass here every day. I couldn't imagine there is something like this. I think we need more of us to come and see this, and then together we can work from an informed point of view, and we see how we change this picture.
We're already saying that we need to have more centers, like you're saying, ensure that every youth, regardless of whether they're in school or not, get this information. And that in essence directly means that you need more people as well, more counselors to get into this space. So in your opinion, what can the government do to ensure that they, you know, maybe put incentives to, you know, motivate people to get into the space of counseling, so to speak, in the villages? Because I'm thinking of a rural setting where this is a family, they cannot afford to pay school fees for their children, and they're actually hard hit. That's where we see big numbers of teenage pregnancies taking place. How then can the government ensure that we have at least every location we have people who have, even if it means volunteering, to go there and give these young people information. Winnie?
Yeah, I think the government can do so much. But I think, like Dennis has said, there are so many challenges right
Correct.
now. Yeah, one of the challenges is funding, you know, to be able to reach deep down there, but also to be able to disseminate information about SRHR for young people. How do we do that? How do we involve the community leaders? You know, we have the LC chairperson. What do they know anyway about young people and the challenges, their health challenges? We have the district people, the local government people. Some of them are not aware of what is going on. So how do we get these influential people at community level to buy in? And that is something that the government can easily do using the existing structures. You know, we've tried to do that. We've tried to do this in some of the districts we are working with to make sure that the DICA, we have what we call DICA meetings. These are district committees on adolescent health are working. So if we can have those meetings, you know, funded more to work better, to reach out to the grassroots, to the young people down there, and we have everybody involved in this, I think that can really work for us.
Are you having programs? We were just having a discussion about persons living with disabilities being discriminated against, and people have this notion that, you know, that this way, do they really know about these matters to do with sexual and reproductive health? During your day-to-day interactions, do you see persons with disability coming in for such services?
Yeah, we've seen a lot of them, and we also have partnerships with the organizations for disabled persons.
Correct.
We've had our health workers and counselors trained in sign language, so they are able to actually communicate with the adolescents who cannot speak.
Yes.
So we are, well, of course we are not yet there where we want to be, but we are progressing because we kind of encourage these engagements with the organizations working with people with disabilities. So it is a progressive effort, and we hope that we shall be able to actually engage more with them.
And we've also provided opportunity for internships for young people with disabilities. There's a young man that I'm so proud of, Robert. He came to our center when he was in O-level senior 2. We walked through him. He did his O-level, he did his high school, he got a government sponsorship to go to Guru University. He has studied, he has graduated. And I mean, it's fantastic. Because when we talked to him, when he was still in senior 2, it was so hard. He was just looking for a place where he can, you know, meet people, and it's so brilliant that you can see it happen.
Wow.
You know?
Congratulations to him, you know, for stepping up and, you know, taking everything positively. On this engagement that you'll be having today with members of parliament, what should Ugandans expect, and how can they take part in this conversation?
I think definitely we will have the parliamentarians. So the young people that will happen to be at the center today will interface. Actually, we've made some segment for them to be able to ask questions directly. Are
you on social media?
Yeah, but also those ones that can follow us in social media. We are doing this engagement with a number of partners, but our tweet hashtag is stand out for SRHR, as in stand out, and then 4 is for SRHR. And then you can also get us at the various Twitter handles at Naguru C, or at Chadinet, or at Uyonet, Uganda. But also you can straight go to our Facebook page, which is Naguru Teenage Information and Health Center. You will be able to do this. We will also stream this dialogue live on NTV and also other channels, BBS and Bukedde. But also, if you want to follow a little bit more, or if you have a question that you feel doesn't relate directly to what is happening, you can call our toll-free helpline, which is 0800 311 222.
Okay, we'll share those on our social media platforms. Thank you so much for you know, taking charge and being at the forefront of, you know, engaging even members of parliament in this very important discussion. We truly hope that at least we see something being brought out of this, and every single youth, regardless of where they are, regardless of their social standing, they get this very important information. Thank you so much for coming on. That has been the discussion today. Let's keep the hashtag going. That will be the big hashtag today, the conversation today: sexual and reproductive health amongst the adolescent. Thank you so much for being part of this. My name is Malaki Vilodera. Do have yourself a blessed day.